A colonoscopy is a medical procedure that allows a doctor to examine the inside of the large intestine, also known as the colon. During the procedure, a long flexible tube with a camera on end is inserted into the rectum and advanced through the colon. The camera allows the doctor to view the inside of the colon and look for any abnormalities, such as polyps or cancer. Colonoscopies are usually done to screen for colon cancer or to diagnose unexplained changes in bowel habits, abdominal pain, or other digestive symptoms. Before going for your colonoscopy, there are some things you need to know. Make sure to watch until the end so you will not miss any of the information on the list. Before we begin, make sure to like this video, subscribe to the channel, and turn on post notifications to get updates on new videos. Number 5. Check for early signs of cancer. During a colonoscopy, the healthcare provider can identify any abnormal growths, such as polyps, in the colon. Polyps are abnormal growths of tissue that can be benign, non-cancerous, or precancerous. If a polyp is precancerous, it means that it has the potential to turn into cancer if it is not removed. During a colonoscopy, the healthcare provider can remove small polyps using special instruments passed through the colonoscope. Removing polyps during a colonoscopy can help prevent them from turning into cancer. In addition to identifying and removing polyps, a colonoscopy can also help detect early signs of colon cancer. If the healthcare provider sees any abnormal areas or growths in the colon during the procedure, they can take a biopsy, a small sample of tissue, to test for cancer. If cancer is detected, it can be treated in the early stages when it is most likely to be successful. Number 4. What is the main tool used in this procedure? A colonoscope is a long, flexible tube with a small camera at the end. It is used during a colonoscopy, a procedure that allows a healthcare provider to examine the inside of the colon. The colonoscope is inserted through the rectum and advanced through the colon. The camera allows the healthcare provider to view the inside of the colon and identify any abnormalities, such as polyps or cancer. Colonoscopes are equipped with instruments that can be used to remove polyps or take biopsies or samples of tissue during the procedure. Colonoscopes are also used to diagnose and treat certain conditions of the colon, such as bleeding or blockages. 3. How to prepare for the procedure. You will be given colonoscopy preparation instructions in advance of your procedure and to read them thoroughly as soon as you receive them. This is the time to ask your healthcare provider any questions you may have and to purchase any prescribed bowel preparation medication. It's also a good idea to have some medicated wipes, such as Tucks or adult wet wipes with aloe and vitamin E, on hand, as well as a skin-soothing product like Vaseline or Dizitin. This is because you may experience high-volume, high-velocity diarrhea during the preparation process. Number 2. How is a typical colonoscopy performed? During the procedure, you will be given a sedative to help you relax and feel comfortable. You will be awake, but you should not feel any pain. The colonoscope will be inserted through the rectum and advanced through the colon. The healthcare provider will be able to view the inside of the colon using the camera on the colonoscope and identify any abnormalities, such as polyps or cancer. The procedure typically takes 30 to 60 minutes. Number 1. After the procedure, after a colonoscopy, you should rest for a short time until the sedative wears off and then follow the instructions provided by your healthcare provider for caring for yourself at home. This may include taking it easy for the rest of the day, managing any side effects such as bloating or gas, and scheduling a follow-up appointment to discuss the colonoscopy results. If any abnormalities are detected during the procedure, your healthcare provider will discuss the next steps with you. It's important to follow your healthcare provider's instructions carefully after the colonoscopy to ensure a smooth recovery. If you have any questions or concerns, don't hesitate to ask your healthcare provider for guidance. Adults over the age of 50 are advised to receive a colonoscopy every 10 years to screen for colon cancer. This is because the risk of this type of cancer increases with age, and a colonoscopy can help detect the disease in its early stages when it is most treatable. That is all about colonoscopy, folks. Please let us know your thoughts about this recommended medical procedure, or if you have some concerns about the information shared in this video. I'll see you in the next one.